Hey everyone, welcome back. We're diving deep into female reproductive system coding today.
Yeah, it's a pretty intricate area, lots of guidelines to keep straight.
It really is.
Yeah.
And getting it right is so important, not just for reimbursement, but also for patient care.
Absolutely.
So whether you're prepping for your coding exams or just need a refresher, this deep dive's for you. And don't forget to check out the Absolute Medical Coding Institute's Medical Coding Guidelines Manual.
Yeah, it's linked in the description.
It's a great companion to have as we go through this.
For sure.
Okay, let's jump right in. Let's say we've got a patient coming in with a vulvar lesion that needs to be removed. What's the first thing that pops into your mind as a coder looking at that documentation?
Well, the first thing I'm going to do is look at, I'm going to be looking for the extent of the excision.
Right, right.
Was it simple? Was it extensive?
That makes a big difference.
Huge difference in coding.
Yeah.
So like if it's a simple excision, like a small superficial lesion, CPT code 56605. But if the surgeon has to go deeper, remove a larger area. We're talking 566 or 6.
Extensive excision.
That's the one.
Okay, so that's one of those details that could easily get missed.
Oh, absolutely.
If you're, just quickly looking at the documentation.
Yeah, you could definitely miss that.
Do you have maybe a good way to remember that, to make sure you don't make that mistake?
Let me see. Think of it like landscaping.
Landscaping.
A simple excision. It's like mowing the lawn, just taking off the top layer.
Okay, I see where you're going with this.
But an extensive excision, that's more like digging up a tree stump.
Oh, I see.
You're going deeper. You're removing a lot more.
Okay, that's a good way to remember it. So now, let's say it goes beyond just removing a lesion.
Yeah.
It turns into a full-blown vulvectomy.
Okay, yeah.
What are we looking for there?
Well, with vulvectomies, you're looking at, was it partial? Was it a complete removal?
Right.
Codes 56610 to 56650. That's where you're at.
Okay.
And if it's a radical vulvectomy, well, then the documentation better be very, very specific.
Specific about what?
About the percentage of vulvar tissue they took out.
Oh, okay.
Yeah.
So, like, if a surgeon removes, I don't know, let's say 70% of the vulvar tissue, that's got to be spelled out.
Absolutely. Got to be spelled out. Impacts the code selection for sure.
It's critical.
Oh, yeah. It's like baking a cake. You miss a key ingredient.
The whole thing's a mess.
Exactly.
Okay. Let's switch gears.
Sure.
Let's talk about hysterectomies. Let's start with the abdominal approach.
Right.
Those CPT codes, 58150 to 58294. What are the things that coders should be on the lookout for in the documentation?
Okay, well, first off, you gotta make sure you understand what type of hysterectomy they did.
Yeah.
Total hysterectomy, where they take out the uterus and cervix, or was it a radical hysterectomy, which they remove a lot more tissue and structures? Big difference.
So you can't just assume it's a standard hysterectomy.
Nope. Gotta look closer.
You really have to dig into the operative report.
Yeah, and while you're in there, check if they took out the ovaries and the fallopian tubes.
Oh, right.
Separate procedures, different codes.
Makes sense.
And, were there any lymph node dissections, any other procedures happening at the same time?
Oh, wow. Sounds like there's a lot to keep track of.
There is.
Any tips for, coders who might be feeling a little overwhelmed by all this?
Well, you got to be systematic.
Systematic, okay.
Okay. First, identify the main procedure, right? The hysterectomy. Then break it down. What type was it? Were there other organs taken out? Any other procedures done?
Okay, break it down. Makes sense.
Step by step. Get all the details.
All right. That's really helpful. Now, what about the vaginal approach to hysterectomy? Those codes are 58260 through 58294.
Right.
Is it similar to the abdominal approach in terms of the coding process?
Yeah, it's pretty similar. You're still looking at total versus radical. Still got to account for any additional procedures, like if they take out the ovaries or if they do a lymph node dissection.
Right.
But of course, the key difference is the surgical approach.
Right.
Got to document that clearly to make sure you use the right CPT code.
So it really is all about those little details that tell the story and tell the difference.
Yeah, that's it.
Okay, good. Now, I want to shift gears just a bit and talk about ovarian surgery.
Okay.
Procedures like oophorectomy, ovarian cyst removal, these codes fall between 5A900 and 5A960.
Right.
What are some of the things that can really make this tricky for coders?
Oh, well, sometimes it's hard to tell if they worked on one ovary or both.
Right.
The documentation really needs to be clear on that. Big difference in coding.
Of course, yeah.
And just like with any surgery, you got to know how complex it was. Simple removal, or were there complications?
So if a surgeon removes a cyst from, let's say, the left ovary,
Mm-hmm.
and then does a biopsy on the right ovary.
Two separate procedures.
Two separate codes.
You got it.
Okay.
And when you're talking about ovarian cancer staging, things get really detailed. Biopsies, peritoneal washings, lymph node sampling, it's a lot.
Sounds like it takes a really, really keen eye
He does.
to code for that correctly.
But once you get it, it's kind of fun, like solving a puzzle.
Yeah, yeah. Putting all those pieces together.
Exactly.
This has been really, really helpful. It's like, having a roadmap. But we've only just scratched the surface, right? What else? What other things should our listeners be thinking about?
Oh, there's definitely more to cover. Yeah, we've talked a lot about hysterectomies, but there's more to it
Oh, there always is.
when it comes to those radical hysterectomies.
Okay, yeah, those are the really involved ones.
Right. You often see lymph node dissections done as part of the procedure.
Right.
And that adds a whole other level of complexity when you're trying to code it.
Because you're not just taking out the lymph nodes. You're also having to figure out, like, how many from what areas.
Exactly.
Yeah.
You gotta be really, really careful when you're looking at that operative report.
Okay.
Look for specific terms, like pelvic lymph node dissection or para-aortic lymph node dissection.
Yeah.
It should say exactly which lymph node groups were removed and how many they took out.
Right.
So you can pick the right CPT codes.
Okay.
Those range from 380-562 to 38572.
So if a surgeon does a radical hysterectomy and removes, I don't know, 15 pelvic lymph nodes, that needs to be like right there in the documentation.
Absolutely. It needs to be clear. You can't just say lymph node dissection was performed.
Right.
You got to have all the details to back up your code.
Otherwise, you're going to have problems with reimbursement and all of that.
Big time.
See, this is why I love these deep dives, because there's always something like, a little nuance
For sure.
that you didn't even think about before.
And it just highlights how important it is to, stay up to date on your coding education.
Oh, for sure.
Because the guidelines change and new procedures come out all the time.
All the time. Speaking of new developments, laparoscopic hysterectomies, those are becoming more and more common, right?
Yeah, for sure.
We talked a bit about, distinguishing between laparoscopic assisted and fully laparoscopic.
Right.
But are there any other, like, coding nuances that our listeners should be aware of?
Well, one thing to remember is that, sometimes these laparoscopic hysterectomies can be a lot tougher than open surgeries.
Oh, okay.
You might have cases where, the surgeon runs into a lot of adhesions, or the anatomy is really unusual, or there are, unexpected complications.
So it's not always just a straightforward in and out procedure?
No, not always.
Okay.
And in those tougher cases, you might need to use Modifier 22.
Ah, Modifier 22.
To show that it was, it took a lot more work, a lot more skill.
Than what the CPT code normally describes.
Right. Yeah.
Right. The unusual procedural services modifier.
That's the one.
But I imagine you need, like, really good documentation to back that up.
Oh, absolutely.
You can't just throw a modifier on there.
Yeah, you got to explain exactly why it was so difficult,
Yeah.
Paint a clear picture for the payer.
Like you're building a legal case.
Exactly.
You need the evidence.
You need the evidence.
Okay, now let's go back to vulvectomies for a second.
Sure.
We talked about documenting the percentage of tissue removed, for radical vulvectomies.
Right.
But there's another thing that people often forget to document.
What? Oh, yeah.
The involvement of any adjacent structures.
Yeah, that's important.
What do you mean by adjacent structure?
Well, sometimes the vulvectomy might go beyond just the vulva and involve things like the urethra, the vagina, or even the anus.
Oh, wow. Okay.
And if that happens, it needs to be documented.
So if a surgeon does a radical vulvectomy, and also has to repair, like, a tear in the vagina, that repair needs to be documented separately, coded separately.
Absolutely. Can't just lump it all together under the vulvectomy code.
Right.
Each thing they do needs to have its own code.
And the documentation needs to support that.
Right.
Man, this is like a detective game almost.
It is.
You know, you're looking for all these little clues
Yeah.
to make sure that you're capturing everything
That's what makes it fun.
and getting it right.
For sure.
Right.
It's challenging, but it's rewarding when you get it right.
Okay, before we move on, I want to touch on ovarian surgery again.
Okay.
We talked about how, coding ovarian cancer staging can get really complex.
Yeah.
But are there any other documentation pitfalls
Oh, there are a few.
that coders should be watching out for when they're dealing with ovarian procedures?
One thing is biopsies. Okay. Sometimes the surgeon will take multiple biopsies, from different parts of the ovary or the surrounding tissues. And it's really important that each one of those biopsies is documented, with the location and any other details.
So if a surgeon takes a biopsy of the left ovary and then a biopsy of, I don't know, the right fallopian tube
Right.
and a peritoneal washing, those all need to be documented separately, coded separately.
Yes. Each one is a separate procedure.
Wow.
And don't forget about frozen sections.
Oh, right.
If they did a frozen section during the procedure, that needs to be in the documentation too.
Because that can affect the coding.
Absolutely.
The level of detail required for this
It's a lot.
is really amazing.
Yeah, but it's important.
It's like building this super intricate model where every little piece has to be in just the right spot.
It's all about painting a clear picture of what happened,
Right.
And that starts with good documentation.
Wow. We've really we've gone deep, haven't we?
We have.
Into all these codes for these procedures.
Yeah, I think our listeners are ready to tackle anything now.
Yeah, I think so too. But before we wrap things up, I want to kind of hammer home this one point again.
Okay.
And it goes back to what we've been talking about, all along. This idea of good documentation.
Oh, it's so important.
It really is the foundation of everything.
It is. You can't code accurately if you don't have the right information.
Exactly. And sometimes, even when the documentation is good, there are still these gray areas.
Yeah, that's
these situations where you're not quite sure what to do. It's kind of like those choose your own adventure books.
I love those.
Yeah. And you get to a certain point and it's like, if you want to go left, turn to page 50. If you want to go right, turn to page 87.
Right. Which path do you take?
And it's kind of like that with coding sometimes.
Yeah.
It's like, which path do I take here?
And that's where you really have to use your critical thinking skills.
Yeah.
Remember, coding isn't just about, memorizing a bunch of rules.
Right.
It's about understanding the why behind those rules and being able to, apply them to different situations.
So you're not just a code monkey, you're a detective.
Exactly. You've got to analyze the documentation, think about the clinical context, and then use your judgment to pick the right code.
Okay, good. And of course, we can't forget about our trusty guide, that medical coding guidelines manual from the Absolute Medical Coding Institute.
That's a great resource.
Yeah, it really is. It's linked in the description for anyone who wants to check it out.
Absolutely. Tons of great information in there.
So to wrap up, what are the biggest takeaways that our listeners should remember from this whole discussion?
I think the number one thing is pay attention to the details.
The details, yeah.
Sometimes the difference between a simple procedure and a complex procedure comes down to one little word or phrase in the documentation.
Absolutely.
So you got to be very careful.
Very careful.
The second thing I would say is don't be afraid to ask questions.
Yeah.
If something's not clear or if you think something's missing from the documentation, reach out to the physician. Get clarification.
Don't guess.
Don't guess. And then finally, never stop learning.
Right.
This field is constantly changing.
Always changing, always evolving.
So, stay curious, keep learning, and keep your coding skills sharp.
I love it. Well, I think our listeners are well equipped now to handle all of the challenges of coding these female reproductive system procedures.
I think so too.
Yeah, they've got the tools, they've got the knowledge.
They got it.
All right. Well, that brings us to the end of our deep dive. Thanks for joining us, everyone.
It was great being here.
We hope you learned a lot, and we'll be back soon with another exciting topic. So stay tuned.
See you then.
Bye, everyone.